Hello and welcome. Thank you for joining for this webinar on adult behavioral health, home and community-based services, infrastructure program extension, the application walkthrough. My name is Meg Beyer. I am part of the Managed Care Technical Assistance Center team, also known as MCTAC, and I'm joined today by partners from both OMH and OASAS, who will walk through our content and some of the materials for today's webinar. I'm going to ask my colleague Tara to advance to the next slide. So a little bit about the agenda today. Our state partners will give us some context and background for the infrastructure program. We'll also walk through some revised guidance and walk through the documents for the application overview, which you'll all have access to through hyperlinks that are provided at the end of these slides. Those hyperlinks are going to be found in the resources section of these slides and the webinar today, and I'll be happy to walk through that for you at the end of the recording today. So with no further ado, I am going to pass things along to our partner, Anita from OMH.
Thank you. Hello, this is Anita Rice from the Office of Mental Health Division of Managed Care. Here we'll be providing some background on the infrastructure program extension. Next slide, please. New York State invested $75 million in HARP premiums between October of 2017 and March of 2019 for the Adult BH HCBS infrastructure and quality programs, which aim to increase access to and provision of Adult BH HCBS for HARP enrollees. $50 million was allocated to the infrastructure program for HARPs and providers to support uptake of BH HCBS, including building capacity, connectivity, and innovative service delivery systems. Beginning in early 2018, HARPs began contracting with eligible providers for infrastructure program activities. In total, 13 HARPs executed 95 contracts and distributed about $35 million to providers to support BH HCBS. $25 million was used for the quality program, which was used to incentivize HARPs to increase new unique BH HCBS recipients. The quality program concluded with the last measurement period ending on February 28, 2021. New York State is extending the Adult BH HCBS infrastructure program for HARPs to financially support both Adult BH HCBS providers and Adult BH HCBS providers transitioning to core services. These services are community psychiatric support and treatment, or CPST, psychosocial rehabilitation, PSR, empowerment services, peer support, and family support and training, or FST. Adult BH HCBS short-term and intensive crisis respite services will be replaced by the Crisis Intervention Benefit Crisis Residence Services, available to all adult Medicaid managed care enrollees. The remaining services will continue as a part of the HARP HIV SNP benefit package under Adult BH HCBS. These services are habilitation, education support services, pre-vocational services, transitional employment, intensive supported employment, ongoing supported employment, and non-medical transportation. Next slide, please. To support the infrastructure program extension, New York State released revised guidance, which incorporated extensive feedback from providers and MCOs. We wanted to incorporate lessons learned to make the application and contracting process easier for providers. Next slide, please. It is anticipated that the process of transitioning to core services will result in an increased administrative burden and additional costs for providers impacted by this change. Approximately $31.5 million of infrastructure and quality funds remains, and HARPs will use this funding for the infrastructure program extension. The amount of funds remaining varies by HARP, and no additional funding will be added to this program. HARPs will assess their network needs and develop infrastructure fund allocation strategies that support existing adult BH HCBS and developing core provider networks. Providers should submit their applications directly to HARPs. Before submitting an application, providers should have a preliminary conversation with HARPs to understand the HARPs member and network needs and their infrastructure funding allocation strategy. Providers should consider this information when they're developing their applications. HARPs will then solicit, evaluate, and award the infrastructure applications based on their network needs and amount of funds available. New York State will not review infrastructure applications or assist in making award determinations. Infrastructure contracts will be executed by HARPs and providers, and they should include both HARP and provider responsibilities, allowable uses of funding, required metrics, budget-based and optional payment schedules, a corrective action process for underperforming providers, a process for providers to submit budget amendments for approval, and a process to earn additional or bonus funds if applicable. Now I'll hand it off to Katie for further information regarding the infrastructure program extension. Next slide, please.
Thank you. This is Katie Merrill. I'm the Director of Rehabilitation Services here at the Office of Mental Health. And I'm going to talk about what providers need to know about the infrastructure program in order to successfully apply and receive a contract. First of all, we incorporated a lot of our lessons learned from the first round of infrastructure a couple of years ago. And something that providers and MCOs consistently shared with us was that when a provider is contracting with multiple MCOs, it was very difficult to align the metrics across those contracts. And so we wanted to standardize that to the extent that we could. There will be 3 types of metrics in an infrastructure contract. First are the required metrics, and that's based on your provider designation status, whether you're a BH HCBS provider who's transitioning to core or a provider who's continuing to provide some adult BH HCBS, there will be some required metrics. And that involves things like maintaining active status in those services, meeting staff training requirements, having qualified staff to deliver the services, and so forth. Then we have budget-based metrics, and these are going to be required based on the specific line items that you include in your budget. So for example, if you ask an MCO for funding to support EHR updates, then there would be a required metric around making those updates. The last category is optional. These are going to be process metrics or performance-based metrics, and those will be negotiated directly between you as a provider and the HARP that you're contracting with. It may or may not be able to standardize these across multiple contracts. That's really going to depend on your MCO partners and the extent to which they're willing to standardize those metrics. But this is really an opportunity for creativity and flexibility, and hopefully to be rewarded for the positive outcomes that you are able to get through this funding. The required and budget-based metrics are standardized. These are going to apply to all new contracts, regardless of your agency size or the amount of the award. So whether you get $5,000 or $1 million, you will need to meet all of the required and budget-based metrics in your contract. Next slide. So who's eligible to apply for infrastructure funds? Number 1, all active adult BH HCBS designated providers are eligible to apply for new infrastructure funds. Then we have active core providers, including those with provisional designation. Now we're recording this in December 2021, which means that there are no active core providers as of today, but we expect that the application period will continue through the spring and perhaps even early summer. And so at that point, we would have provisionally designated core providers. And then we have behavioral health independent practice associations, or BH IPAs, that have core providers and or adult BH HCBS providers in their network. That would be any BH IPA with at least one of these providers in their network. And if you're a core provider or a BH HCBS provider listening to this, and you're also a member of an IPA, now is the right time to start thinking about whether you want to apply for these funds as a part of the IPA, where perhaps they're helping you with some of the administrative requirements, they're administering the funds, they're supporting the reporting functions, and perhaps coordinating between providers to do things like the LPHA recommendation. There may be some real advantages to contracting in that way and being relieved of some of the administrative pieces. On the other hand, it does mean that some of the money will likely go to the BH IPA to support those administrative functions. And so you need to look at how much that's going to cost of your total award and weigh whether or not it's worth it for you. Eligible providers can apply individually or in partnership with other providers or as a part of a BH IPA. Now, something I want to just briefly point out is that in the previous round of infrastructure, we did allow for care management agencies, recovery coordination agencies, and training entities to apply for infrastructure funding. At this point, no new contracts will be awarded to CMAs, RCAs, or training entities. Next page, next slide, sorry. So what can you use this funding on? We've got just over $31 million that's going to support the continued sustainability of BH HCBS and the transition to core services. Allowable expenditures include staffing and workforce development. That could be things like the cost of recruitment, training, and supervision for staff. Perhaps you'll even offset some of the salary and fringe while staff build up full caseloads. Technology and systems infrastructure, that could include purchasing computers. It could be anything from mobile devices to a HIPAA secure platform for telehealth. We also have telehealth capability, which could be, again, the mobile phones, tablets, data plans, training for staff, software, those types of things. Any additional technology infrastructure that doesn't fall into the above categories. Service infrastructure, so that might be funding to support engagement. Maybe you get a museum membership so that your staff can take people into the community and meet in community locations. Strategic planning and core designation. We know that there's going to be costs associated with the core transition, whether it's working with your compliance department, your IT department, with executive leadership at your agency. All of that strategic planning costs time, which is money. And so we want to offset some of those costs to your agency. And then any other expenses that you can think of that would be appropriate, that relate directly to the goals of this funding, the intent of the funding, and that are deemed appropriate by the HARP or MCO. Next slide. Applications, funding exclusion. So there are some things that you can't do with this money, and this is detailed in the guidance. Applications or costs not addressing your provision of BH HCBS, anything that's not related to BH HCBS or core services, or directly related to an increase in capacity to deliver these services to more HARP members. So you can't use these funds to support a different program like PROS or ACT. You cannot use these funds for member incentives for participation in or completion of services. So you can't give someone money to come and meet with you for an assessment. That would not be allowable. Reimbursement for any clinical or rehabilitative service fees. So all of the services that you're providing to individuals should be billed and claimed appropriately. And the funds that you receive in reimbursement for those claims, that is paying for the service itself. The infrastructure funds are not paying for services. They're paying for the infrastructure that will support sustainability of services moving forward. Crisis respite services that were included under Adult BH HCBS have actually moved over to the crisis intervention benefit. And so anything related to those services would not be appropriate for this funding. Any lead agency or BH IPA operations that are unrelated to core services or BH HCBS. Lead health home entities cannot receive these funds in support of health home activities. Any physical plant modifications or rent would not be appropriate, and outreach to members not yet enrolled in an eligible health plan. So during the first round of infrastructure, some providers really did a lot of outreach to people who were H9 only. They weren't in a HARP or an HIV SNP. And that really didn't work out terribly well. So this funding is intended to support core and BH HCBS for people who are HARP enrolled and HIV SNP enrolled HARP eligible. Next slide. There are also some caps on these funds in terms of what an appropriate expenditure would be. So admin and overhead is capped at no more than 15% of the total award. That's pretty standard across any kind of state funded initiatives. Electronic health records and electronic billing software, these will likely need to be updated to support the core transition. We've talked to a number of people in the field and we've determined that approximately $10,000 is an appropriate cap for these costs. Now, if you were to amend your EHR or modify it to connect to a regional health information organization or RIO, then you could go up to $15,000. But these funds are not intended to support things like ongoing licensing fees for that software. And lastly, if you were to invest in your site to purchase furniture, desks, office supplies, or I should say office furniture, that would be capped at $5,000. These are home and community-based services, meaning that they are intended to be provided in home and community-based locations, now that they are formally HCBS, but they are provided in the community. And so we don't want to be building up program sites or anything like that. We want to keep the focus on community-based service provision. All right, next slide. The recommended funding tiers are outlined in the guidance. These are important because providers should really understand the scope of these funds and what they're intended to do. So what we have done is we've recommended funding tiers based on the number of HARP members that the provider has served over the previous 12 months. So if you're applying in December 2021, then you would look at November of 2020 to November of 2021, and how many unique recipients did you serve in BH HCBS? If it was fewer than 5 individuals, perhaps you've really struggled to get these services off the ground, then you would be appropriate for up to 100,000. 5 to 20 members up to 250,000, 21 to 60 members up to 500,000, 61 to 120 up to 750,000, and more than 120 members served would be up to $1 million. I'm sorry, $1 million if you've served more than 120 members. Now, HARPs do have discretion to exceed these recommendations up to $1.5 million per provider. So if you have served 15 people, there's nothing to stop you from submitting a request for more than $250,000. It's just that we're not sure that would be the best investment of a HARP's funding. So it's really a decision that's between you and the MCO, what's appropriate. The only hard cap is $1.5 million. Now, as a provider, you cannot accept more than $1.5 million across all of your awards. So if you apply to 6 MCOs for $1 million each, and they all agree to that, that's $6 million, which puts you far in excess of the 1.5 million. And you would need to look at the terms of each contract to decide which ones are most attractive, whether you want to reduce the awards across all MCOs or whether you want to only proceed contracting with a couple of those MCOs. You cannot exceed $1.5 million. All right, next slide. And with that, I believe I am turning this over to the managed care division.
Yep, thanks, Katie. So hi, this is Emily Hetzel from the Office of Mental Health, Division of Managed Care. And in this section, my colleagues and I are going to walk through the infrastructure program extension application process and application materials. Next slide, please. So just like in the initial infrastructure program, New York State developed standardized application templates for the infrastructure program extension. These application materials are very similar from the initial infrastructure program, but they've been streamlined and condensed. So hopefully it's a little bit more straightforward. There are a total of 3 application forms, which are PDFs, and an application budget template, which is in Excel. The application forms are Form A, Agency Information and Funding Request, Form B, Lead Agency and BH IPA information, Form C, Provider Attestation, and the Infrastructure Program Extension Application Budget Template. So the Infrastructure Program Extension guidance and these application materials were released in early November and are posted to the OMH website. Links to these documents are included in a resource slide at the end of this presentation. As mentioned earlier, providers should be submitting their application materials directly to HARPs. All 11 HARPs provided their infrastructure contact information to the state, which is now available on the MCTAC Plan Matrix. And in addition, those HARP infrastructure, that contact information was also sent out to providers from the Adult BH HCBS provider mailbox a few weeks ago too. We encourage providers and HARPs to engage in collaborative dialogues during the application process to make sure that applications or budgets are aligned with HARP's membership and network needs. And it's important to know that the state included information about dates and when applications can begin to be submitted and when contracts need to be executed in the infrastructure guidance, but that HARPs can determine their own application timeframes and deadlines. So some HARPs may be looking to execute contracts earlier than the midsummer deadline that the state set. So it's important that providers communicate with HARP and really understand what a HARP's application deadline might be. Each HARP will be developing their own infrastructure funding distribution strategy. And so to determine whether provider application aligns with a HARP's network needs, a HARP may decide to develop a supplemental application form to elicit additional information from providers. So please just note that a HARP may ask for some additional information after you submit your initial application forms. So this is also mentioned earlier, but just to kind of reiterate, providers are able to apply to multiple HARPs, but they cannot receive duplicative funding for the same expenses. And as Katie mentioned earlier, there is a cap of up to $1.5 million across all infrastructure contracts. So providers cannot receive more than $1.5 million in infrastructure funding. It's also important to note that these infrastructure contracts will be competitive and providers are not necessarily guaranteed to receive funding. Next slide, please.
Okay, so let's look at the application. Now, something that I want to point out, because I'm not sure that I emphasized it enough earlier, is that only active providers can apply for new funds. So what does it mean to be an active provider? Just briefly, it means that you have a current contract with an MCO to provide BH HCBS services. Or if you're a BH IPA, that the providers in your network have such a contract with an MCO, it means that you have qualified staff who have met our training requirements. And it means that you are actively accepting referrals and providing services, or perhaps you're providing services, but your caseloads are at maximum capacity. So you're not accepting new referrals, but you are actively engaged in service delivery to the individuals on your caseload. So you have to be in active status in order to get a contract for infrastructure funds. Now let's look at this application. Application Form A is required for all providers requesting infrastructure funds. As you can see on the screen, this is exactly what it looks like, and I'm going to walk you through it briefly. This form contains a couple of sections. If you just scroll down a little bit in section 1, you'll see some basic identifying information. So who's your agency? Where are you located? What's your NPI and MMIS? So this just tells the MCO who you are. You should provide an application contact, someone who can is high enough of a level that they can start negotiating and talking to the MCO about the application, but perhaps not so high up that they don't know the details. So just think really carefully about who your application contact might be. If you keep scrolling down, you can indicate which RPCs you deliver services in, and yep, keep going. You'll also indicate which BH HCBS you're providing and which core services you anticipate providing. Now, this should be directly related to each other. If you're applying right now in December or January before core goes live, you would check CPST under the service you're currently providing, and then CPST under you anticipate providing that under core services. If you're not currently providing CPST, but you think maybe someday you will, I would not check it at this time under core. You should really only indicate the services that you're currently approved to provide. In item I here, you're going to tell the MCO how many individuals you have served over the last 12 months prior to submitting the application. You will exclude anyone in short-term crisis respite or intensive crisis respite. But if they were receiving any of the BH HCBS listed above in G, then you would count them as a unique recipient served. Now, this is not specific to the MCO that you're applying to. So if you're applying to MCOA, you don't only count MCOA's members. You're going to tell them your full number of unique recipients served so that they can really see the scope and size of your program and the success of your program to date. Now, if you scroll down, there's a couple of narrative sections. Yep, you're gonna say which MCOs you're applying to, where you're contracted, keep going. This should all look very familiar to people. And here's where you get to your funding request. Now, this should align very well with your budget. So you'll take the amount on your budget that you had dedicated to these different line items, and then you'll provide a very brief narrative description in that third column for how the funds will be used. Keep going. Yep. You're going to describe how much of the funding is for one-time fixed expenses. So maybe you're buying a car, and so the cost of the car is one time, but then the maintenance for the car is ongoing. So if you're making any one-time investments, a computer, a car, things of that nature, then you would put that in item B here. We're also asking you to describe any proposed expenses included in the AO and H category, and that's to make sure that there's no duplication and that we fully understand, or the MCO fully understands what it is that they're paying for under administration and overhead. Scroll down to D, please. Anything that's categorized as other, you should also include narrative for, so that the MCO can make a very clear connection to how this expense will support the agency's transition and capacity to deliver core services. So we don't want to see overuse of other, and when you do use it, you'll want to clearly describe what those expenses are. And then we have a question around how the agency will ensure that clients are connected to a licensed practitioner of the healing arts for the purposes of a recommendation to core services. Now, if you're only providing BH HCBS, you have no services that will transition to core, you could put NA for this. Most agencies have at least one service that will be transitioning to core, however, and we want to see that you have developed a plan for how you're going to get the LPHA recommendation, which is necessary to document medical necessity for new referrals. And how are you going to build up a referral network for these services? You can't just rely on health homes to send you referrals. You want to broaden your network. So are you going to reach out to hospitals or primary care doctors or clinics in your area? This is where you tell the MCO what your plan is. F is important to indicate whether you've received infrastructure funds from any HARP, because that might tell them that they want to have a conversation with you about what worked, what didn't work, and how you're incorporating those lessons learned into round 2. All right, keep going. In section 3, this is where we get to our metrics, where you're going to suggest as kind of an opening request what you think your metrics should be. You have the required metric in the left column. Then we have a definition that just says basically we want to make sure that every MCO and every provider is interpreting this in the right way. So I'll just use this first one as an example. The agency maintains active status as a BH HCBS provider through the contract period. This is for those providers that are going to be continuing to provide some BH HCBS. How do we define active status? Well, right here, we tell you to look in the guidance for the definition of active status, and that this would be monitored through agency self-report. So perhaps quarterly, you'll submit some sort of a report or an attestation saying, yes, we still meet this definition as it is defined in the guidance. Okay, scroll down. Keep going. You can scroll right down to the budget-based. Yep, keep going. Here you have the budget-based metrics. So again, I'll just go over the first one as an example. If funds are requested to support hiring, sustaining, and training direct service staff, and that would be for BH HCBS or for core, then the agency needs to hire qualified staff to deliver the services, and all staff need to complete the trainings. how is this defined? So if the funds are allocated to support hiring and training direct service staff, then you need to identify your staff needs and post for open positions. If you can scroll down, each full-time equivalent supported by the infrastructure funds should be filled within appropriate timelines that are negotiated between the HARP and the agency. So in that last column is where you would put what you believe the appropriate timeline might be. All staff will complete the required trainings via CPI within established timeframes established by the state. So our staff training memo was recently released, and you can look to see what the appropriate timelines are and put that in your contract. And the agency and the HARP will monitor progress toward this metric through agency self-report. The HARP may also request CPI training transcripts from the agency to confirm completion of the staff trainings. All right, now if we want to scroll down to optional metrics. Thank you. Here you'll see we have not filled in any of this grid. This is where you can be creative and show the MCO what it is that you think you can achieve with these funds. You don't have to include anything here. You might start with nothing. You might put out a few different metrics for negotiation with the MCO. Remember, this is just the application. It's not the contract yet. So feel free to get creative and talk to the MCO, find out what their assessed needs are. Maybe they have a significant portion of their membership that is Spanish speaking only, and they need agencies that have Spanish speaking staff. That might be something that you can really specify here and drill down to how you're going to meet the MCO's needs and how you're going to get creative. The optional metrics may be able to lead to bonus funds depending on how you structure your contract. So really show the MCO what you think you're able to do and what you're capable of. All right, I believe that that's the end of Form A. So if we want to go back to our slides. If you have any questions around what would be appropriate to put in Form A, please feel free to reach out to us at Adult BH HCBS at omh.ny.gov. And also make sure that you're having conversations with the MCO so that you're really highlighting what you're able to do and how you're able to meet their needs. All right, I'm going to turn this back over to the Managed Care Division.
Thanks, Katie. So the second application template is Form B, which is the lead entity information. This form must be completed by lead entities applying for infrastructure funds in partnership with at least one other agency. Lead entities could be provider agencies or behavioral health independent practice associations. The lead entity will be responsible for managing an infrastructure contract on behalf of all of the partner agencies party to the application. In addition, it's not just about managing the contract or funding. Lead entities should also be developing a plan to help their partner agencies transition to core services and operate sustainable BH HCBS programs. And for core services, this would also mean assisting providers to develop a referral network and ensuring that they have access to an LPHA. Form B also asks for information related to the total funding request for all providers included in the application and how the lead entity plans to manage the infrastructure contract. Lead entities must submit both Form A, which outlines their own piece of the application, and Form B, which applies to the entire application in order for the application to be considered complete and submitted to a HARP. Please note that single agencies submitting an application do not need to complete application Form B. It's only for those applications which have multiple provider agencies seeking funds through the same application. So now we'll actually toggle over to the application Form B and review. So application Form B is actually pretty short. Section 1 just asks for simple, lead entity identifying information like agency name and the application contact. Section 2, in this section, lead entities should include the total funding request amounts by category for the entire application. The total should include all the individual provider funding request amounts outlined in those providers' Form A's, and it should also match the information reported in the application budget template Excel document, which we'll review in a couple slides. We can keep going. And section 3 is where the lead entity is really going to explain how they plan to manage the infrastructure contract on behalf of their partner agencies and what their role will be. So in questions A through D, the lead entity will outline what their role will be in administering the infrastructure funding and managing the contract on behalf of their partner agencies, how they plan to help their partner agencies transition to core services and ensure sustainability of BH HCBS programs by their partner agencies, and how they plan to assist in developing a core service referral network, and how they can help ensure their partner agencies have and are building sustainable processes and systems to receive core service referrals and access to an LPHA for those providers that don't have an in-house LPHA. Okay. I think that's it for application form B.
Hi, this is Katie again. I'm going to briefly go over the provider attestation, which is Form C. Now, this is required for all providers, including lead entities and their partner agencies requesting infrastructure funds. So whether you're applying on your own or as part of a group, you would need to complete the provider attestation. Now, this should look very familiar to anyone who applied the first time around. What you're attesting to is, number one, your eligibility to receive active funds, which means that you are confirming your designation status and your active status. You are attesting that you will abide by the infrastructure program guidance. So you're not going to spend funds on ineligible expenses, and you will be acting in line with the goals and intent of the funding. You're going to submit HARP required deliverables. You attest that you will not accept more than $1.5 million across all of your infrastructure contracts. You can apply, like I said, for as much as you want, but you cannot accept more than 1.5 million. And that you will continue to provide core services and/or BH HCBS. So if we want to look at the form briefly, I'll highlight some of these things for you. So the attestation should be completed by the executive director or their designee. And basically you are just agreeing to participate in the infrastructure program extension and the program parameters. You'll see under 2A, that's where you confirm that you are an active provider. Just keep scrolling. If you look down under number 6, I just want to point out this is where you attest that you will not accept funds in excess of $1.5 million. Keep going. And then there's also a section here for the BH IP, the BH IPAs would leave blank. So this is again around your active status. And this is very important for both BH HCBS and core, that you are able to accept referrals, that you're actively providing services. And that's important for MCOs to be aware that you have the capacity to provide these services. Okay, so as you can see, you have just signature, title, agency name, and date signed. This should be, as I mentioned, signed ideally by the CEO or someone else who has the authority to sign on behalf of the agency that's applying. And that's it. I think we can go back to the slideshow and advance to the next slide.
Great, thank you. So the last piece of the infrastructure program extension application package is the budget template, which is an Excel document. All submitted infrastructure applications must include an application budget template to be considered complete. And as you'll see in a second, there are multiple tabs, but only one tab needs to be completed, either the single agency application or the multiple agency application tab. Also, just a reminder that responses on the budget template should match the corresponding sections in the other application documents, like in Form A and Form B if applicable. Okay, so now if we can go to the application budget template, I just want to highlight that the first tab that you're seeing right here is a very detailed instructions tab, which will walk you through how to appropriately complete the application budget. And as you can see, there's a section up top here about just some general information, and then separate instructions for each of the tabs, which again is a single agency application tab and the multiple agency application tab. So we're first going to go to the single agency application tab. So this tab is only filled out for providers submitting an infrastructure application themselves. You know, there's not going to be a lead entity. It's just a single agency submitting an infrastructure application to a HARP. And so a lot of this information is going to refer back to some information on Form A that will be submitted. So if you look in row 6, you know, the agency just needs to enter the agency name. And then in row 7, the agency is going to just select from the drop-down the estimated total number of the unique BH HCBS recipients served in the prior 12 months. So this number should match the response put in application Form A in section 1H. And if we keep going down, we get into the funding category sections. And so the funding categories on this template match the funding categories outlined both in the infrastructure guidance itself and in Form A. Also, just to note that the totals for each of the funding categories will be calculated automatically as you fill the template in. You know, the totals will start appearing and being calculated. So for this staffing section at the top, please enter the total salary and wage information that is being requested. Section B below, which we'll get to in a minute, will ask for very detailed staffing information. And so those totals will be, you could carry those totals from below up here to this section. And just to note, the row that has the percentage of fringe requested will be also calculated automatically. That's not anything that you have to calculate yourself. And if we start to scroll down, you know, applicants will list the funding requests in each of the remaining categories, which includes workforce development, technology and systems infrastructure, telehealth capability, additional technology infrastructure, service infrastructure, strategic planning. Then there's another category, which Katie explained what kind of things fall into that earlier, and administration and overhead. General reminder, administration and overhead is limited to 15% of the total infrastructure funding request. And please note that in row 72, the percentage of the administration and overhead requested will be automatically calculated, as will the total proposal amount in row 73. So if we keep scrolling down, we'll get to section B, which asks more detailed information about staffing. So some providers will request infrastructure funding to help support staff salaries. And so this is where providers will explain, you know, where staff will be employed, you know, what that person's position or title might be, and what their function will be in the agency, including, thank you, also, you know, what the expected salary or wages of that individual will be, and the percentage of their full-time employment, which you can see in column E. And just to note, the totals for the staffing section, which you see in column F, again, will be automatically calculated. And if we scroll down a little bit, all of this is totaled at the bottom as well. So if we move on to the third tab, So this tab is to be used for applications with multiple providers requesting funding. This tab has the same information as the one we just reviewed, the single agency application tab. The only difference is that it includes additional columns where the lead entity will enter its own information, and for each of the partner agencies' information in each individual partner's agency's budget information. So the lead entity will enter their information and their budget request amounts in column C, and each individual partner agency information will be detailed beginning in column D. We're not going to scroll over, but just to note there are columns for up to 25 partner agencies, but if additional columns are needed, that can be added too. So column B, where it says total request amount going down, these totals, this column will total everything from the lead agency and all partner agency information over. So it's an automatic calculation for the entire application. And if we start to scroll down, again, for staffing, it's just the same as the previous tab. The lead agency and partner agencies will enter in the total salary and wage information. And again, more detailed information will be included in section B below. The same rows that we just reviewed will be calculated automatically in this tab as well. And again, going down, applicants will list for the entire, all providers party to this application, the requested funding for each of the remaining categories, which includes, again, workforce development, technology and systems infrastructure, telehealth capability, the additional technology infrastructure, service infrastructure, strategic planning, and other, and lastly, administration and overhead. And as a reminder, again, administration and overhead is limited to 15% of the total funding request. And just a reminder as well, BHIPs are also limited to a total of 15% of the total infrastructure application award for managing the infrastructure contract. And if we scroll down a little bit, again, section B is for staffing and will be calculated in exactly the same way in the previous tab we looked at. Again, you just enter in where staff would be employed, their position title, what their role or function will be, what they expect to be paid, during the course of the contract, what percentage of a full-time employee they are, and what their the estimated expenses are. And this information can be, again, carried up to be put into the staffing section in section A. I think that is it for the application budget template piece. I think we're good to move on.
So thank you to our state partners who just walked us through all of that content. This is Meg again, coming back from the MCTAC team, and I'm going to ask my colleague Tara to advance to the next slide. So as you are listening to the recording and hopefully scrolling through the slides, we just wanted to direct everyone's attention to these resources. So everything in blue on this slide right here is a hyperlink. So if you click on it, it will automatically take you directly to the resource we're referring to. So first and foremost, if you aren't familiar with it, we would encourage you to visit the MCTAC Plan Matrix. This is a centralized resource that contains all of the information for each of the MCOs and HARPs, all in one centralized place. So if you are looking for contact information, please go there and visit that for any contact info you might need. Additionally, there's a large number of material located on the OMH website related to the infrastructure program extension guidance. So we would refer you to that website for any information centrally located there. And for all of the forms that we talked through and walked through today, you can locate them through these various links located on this page, whether that's Form A, B, or C, or the infrastructure application budget template, which Emily just wrapped up. So with that, I'm going to see if any of our state partners have any last few things to say before we conclude our recording today.
Thanks so much, Meg. This is Katie Merrill. I know today's presentation focused on briefly going over the guidance and then the application forms themselves, but I do want to emphasize that the very first step our providers should be taking is having conversations with your contracted MCOs to hear about what their needs are, what they're seeing among their network, and how they see infrastructure funds as supporting the needs of their network. So, they are engaging right now in a needs assessment activity where they're looking very closely at the data to determine how these funds could have the biggest impact for their members. And we'd really like to see providers reaching out and initiating those conversations and hearing about whether they have language access issues or rural access issues, or perhaps the outer boroughs of New York City have difficulty getting staff. If you're able to meet those needs, you're going to be more successful in applying for those funds. So before you put pen to paper, please pick up the phone, use the MCTAC matrix to identify your partners at the MCOs and talk to them about what it'll take to have a successful application. We wish you the best of luck in applying for these funds, and we're very excited to see what happens in the BH HCBS and core community. Thanks.